The Omicron variant is blazing a trail across New Hampshire right now. If there's a silver lining, it's that its illness that it triggers is not quite as severe as prior variants, but it is still packing a punch. This morning, we are joined by Dr. Marcus Hampers, President and Chief Medical Officer of ClearChoice MD, and Dr. Mark Punt, President and Chief Medical Officer for Convenient MD. Thank you both doctors for connecting with us today.
Morning. Thank you.
My pleasure.
Good morning, Dr. Punt. Let me start with you. Give us a sense, what is it like for day-to-day operations right now? How severe is the situation?
Our volume in our clinics now is higher than it was a year ago during the holiday season and in January. This is related to the Omicron variant causing being much more contagious than the variant of last year, which was the Alpha variant. And has led, therefore, to more symptomatic patients who want testing and to determine is this related to COVID or related to other cold or flu-like symptoms or illnesses. So our volume is higher, and that is complicated a bit by the fact that as you noted, that the staffing challenges are greater due to the Great Resignation and the effect of on the healthcare workforce and burnout due to the length of this pandemic.
And Dr. Hampers, it's crowded for hospitals too. Do you get a lot of people coming from overcrowded ERs looking for help at your facilities?
Well, we do, Sean, and we're facing the same challenges that Dr. Punt mentioned, extraordinary patient volumes, and keep in mind that the safety of our patients and our staff are our top priority. So even if we're only seeing, 50 patients at a center for testing, we have to follow the same safety procedures as we would if we saw 500 at that center. And for those folks who are not frontline healthcare workers or first responders, they may not appreciate how physically exhausting wearing PPE for a 12 to 14-hour shift can be. I mean, we have staff that have developed abrasions behind their ears from the loops on the mask, bruises and abrasions on their face from the goggles, and rashes from the non-breathable gowns. As far as supporting our local health care systems, we'd like to think they were decompressing them by performing all of this testing, but we're also seeing some traditional urgent care, but far less than what the testing is. Most of our patient visits are COVID-related, upwards of 60% of the visits we're seeing. And without COVID, of course, all of our visits would be traditional urgent care.
Yeah, and Dr. Punt, let's stay on that note. If you're so busy, have you had instances where you had to send patients from your facilities back to the hospital because you're so busy?
We have not had to send them to the hospital due to us being so busy. What we are able to do is have them come back later in that day or early the next day for the services that they have come for, whether that's urgent care, standard urgent care related, or related to testing or evaluation for COVID-19.
Dr. Hampers, let's talk testing for a moment here. ClearChoice runs the state sites here in New Hampshire, and some Granite Staters have told us that they've had to wait 4, 5, 6, 7 days for results. What's going on with the delays there?
Well, just backing up, the governor and his team have been very forward-thinking in their efforts to control the spread of the virus throughout the entire pandemic. And when the state partnered with ClearChoice MD, that was no exception. The goal was to eliminate or reduce any barriers that people might have to getting tested. So the governor wanted more accessibility, more sites for patients to go, but he also wanted to make it free in the event that cost was a barrier. And we spun up 4 independent sites, and prior to locating those sites, we inspected the physical space for capacity, and we did that in conjunction with the state as well as local police departments. But I think all of us underestimated the ferocity with which Omicron is spreading, and the volumes have skyrocketed. And in turn, what's happened with the labs that are processing the specimens is that they can no longer, because the positivity rates are so high right now, approaching 40 to 50%, they can no longer test batch samples like they were doing when the positivity rates were low. For example, they could send 4 specimens through the analyzer at one time, and if no virus was detected, all 4 were negative. They can't do that anymore, and that's created these prolonged turnaround times that we're all experiencing.
So do you think those wait times will stay 3, 4, 5, 6 days for now anyway because of the demand?
Well, so I've met with several of the lab folks, and they're experiencing the same challenges that every business in the country is right now. But they've assured us that they feel that they can catch up and get back to a more normal turnaround time, which would be around 2 days.
All right, Dr. Pond, let me ask you, is there anything different about the Omicron surge compared to some of the other spikes that we've had in terms of transmission?
Yes, the Omicron variant is much more transmissible and contagious than the other variants, even than the Delta variant. I think in the range of 4 to 6 times more contagious than the Delta variant, which was 2 to 3 times more contagious than the original Alpha variant. So it is more contagious. As you noted, it appears to be less severe in general in illness, especially to those who have been vaccinated. So getting one's vaccine as well as booster is important to not only prevent disease, but prevent severe disease. I would also like to give some feedback on the turnaround times. We happen to have our own highly complex lab for COVID PCR testing in Salem, New Hampshire, and we have been able to maintain those turnaround times to under 48 hours through this point, and are expanding our lab services to be able to maintain that into the future.
Yeah, good to know. Dr. Hampers, a few years ago, urgent cares took care of kind of everyday health things, ear infections, cuts, sprains, burns, that type of thing. How has this been impacted with COVID? And you mentioned before, a lot of it is just COVID cases at this point, right?
That's correct. But we expect that eventually the traditional urgent care visits will return. But when the pandemic struck, a lot of people didn't have familiarity with urgent care, and through COVID and the need for testing, a lot of first impressions were made on patients who didn't really understand urgent care. And when the pandemic first struck, as you may recall, doctors' offices were closing, and healthcare systems were bracing for what we expected to be an onslaught of critically ill COVID-infected patients. So it's not often that you think of urgent care as saving lives, but frankly, without the urgent care industry, hundreds of millions of Americans would not have been tested in a timely manner. And without that testing, potentially vulnerable people could have been exposed and suffered serious illness and even death. So I like to remind our teens when they're feeling exhausted that our work is very important. And I commend all healthcare workers for the endurance that they've shown throughout the pandemic.
And do you think after COVID, people will continue to go to some of these other places besides a hospital?
Yes, I do. And we're already seeing that. So we've seen entire families come in to be tested, and then mom will bring the child in for an ear infection, 2 or 3 months later. So it's ironically, it's been very good for the urgent care industry in terms of exposing people who otherwise were not familiar with urgent care.
Yeah, Dr. Pond, let's bring you back in here. I know a lot of these people working are so busy. They have to wear the PPE every day. Have you found that there's a burnout factor with this, folks getting really tired?
Well, yes, I think the healthcare workers, the frontline workers, are fatigued, and there is some burnout. There, we are working very hard with our teams to support them in every way possible. To be able to ensure that we can reduce that burnout. But due to the length of the pandemic and the multiple surges of variants, the healthcare system, the healthcare workers and frontline workers and urgent care workers are at a point of burnout. So it is up to the rest of the team to support them in ways where we can reduce that burnout.
They certainly have been working very hard over the last year and a half or so. Let me ask both of this, and Dr. Pond, I'll start with you. What has your approach been to mandating vaccines for your employees?
So in late June of last year, prior to any governmental expression of what vaccine mandates would be, we worked with our team to develop a vaccine policy, which included strongly encouraging everyone to be vaccinated and boosted. However, for those who did not feel comfortable with vaccination, we implemented a surveillance testing and a weekly surveillance testing, which we, of course, covered, so that we could ensure that anyone who was asymptomatic and positive was isolated at home, away from other staff and team members and patients, and just enhance the security of our locations. Because of that, we did not lose any team members with this policy, and have been very successful in keeping our team members safe and healthy.
And Dr. Hampers, what about Clear Choice? Is there a thought about vaccine mandates?
No, so our policy is nearly identical to what Dr. Punt just articulated. We did not mandate the vaccine.
And real quick, while I have you here, what is your outlook for the weeks ahead as we deal with this Omicron surge?
I wish I could tell you with certainty, but what I do know is it's not often that the experts have been aligned in their predictions throughout the pandemic, but I think we're starting to see some alignment among all of the experts. And I think Omicron is going to crescendo. And after that, I don't know exactly what the landscape will be, but I think it'll be markedly improved. You know, COVID is going to become a permanent fixture on the landscape going forward. And we're going to need to, learn to live with it and treat it similarly to the flu going forward.
All right, we'll have to learn to live with it. Dr. Hampers, Dr. Punt, thank you very much for joining us here on Close Up.
Thank you.
Thank you. Have a great day.